Regional Medical Center received high praise, recognized as one of the top 100 hospitals in the country by an industry research firm. Now, along with being the leading provider of health care, New Hanover Regional is also one of the largest employers in the eastern part of the state. Carolina in the Morning's John Evans takes a closer look at what's ahead for the organization.
All right, this morning we're taking a closer look at New Hanover Regional Medical Center because there is some news coming out about this organization. Jack Barto, President and CEO, with us. Good news about your organization, named one of the strongest hospitals in the country.
Yeah, we're very pleased with that, John. iVantage came out with the ratings based on a series of hospitals, measurements and criteria to try to show who's going to be able to succeed and be able to potentially deal with all the changes that are coming down. And we were rated one of the top 100 hospitals to be able to do that on a wide range of areas, from quality, finance, service, patient experience. So we were very pleased with that market dominance, market share. So clearly I think that shows us the efforts of the last 8 to 10 years are paying off, and we believe healthcare is going to be a huge economic recruitment opportunity for people in the future. So we're excited.
The Obamacare troubles, a lot of hospitals I've been reading are dropping insurance and things of that nature. What challenges is it presenting to you in this atmosphere?
Well, we know we're going to take, as a result of Affordable Care, $280 million of cuts over the next 10 years. Part of the offset that is supposed to get more people insured. North Carolina did not expand Medicaid, and clearly the enrollment phases for the early phases of Obamacare has not produced any new insurance in the company. So some of the offsets to that $280 million in cuts are clearly at risk right now.
And what does that present to you then as you try to run a business and a healthcare organization?
I mean, it shows that the work we're doing is going to have to be continued, and we're going to have to use lean principles, which we've done Toyota management, to help us find the waste in the organization and improve experience at the same time. That will hopefully drive business to us because we're delivering a good product, and will lower our cost at the same time.
As you have been in this organization and in this industry, it used to be that people came to hospitals. Now it's almost like hospitals have to go out to the people as far as providing care. You've done that by going into Brunswick County. You've done that going into some of the other outlying areas of Wilmington and New Hanover County. Still in your ballpark for the next 5 to 10 years?
I think it absolutely has to be. I mean, for us, we're the tertiary provider for Southeast North Carolina. We need to figure out how we can work with the other organizations out there to support them in their community, but when they can't do something or it's beyond their capabilities, that they can seamlessly come over here. But we're also building a freestanding emergency department in the northern part of the county, right on the New Hanover-Pender County line in New Hanover County. Again, you've got to go out, you've got to make things easier and more convenient. Like any other organization, you can't expect everybody to come to you. You also have to go to them, which is I think our expansion. So I think you'll see our footprint expand in smaller ways, and I don't think you'll see as much work done on this campus.
But you still will be the emergency provider as well. You have to be, because as the primary care provider for so many families, it's really kind of changed your ER outlook, correct? With
60, you still got 60-some million, I think was the last number I saw in insured. Our emergency departments are absolutely going to be there. We're going to redesign the emergency department in New Hanover County, and I think part of that's going to be the last probably big expansion you see is to fix our ER here, because it was built for 50,000 visits, and we're all going to see 100,000 in this campus next year. And we're going to have an area where if you need to be in an emergency department, you're going to move to the critical side. If not, we're going to put you in an area where we can get you out quicker, but also cheaper. And because 30% of the people who come to our emergency rooms don't pay us a dime. They're not capable of it, John.
So where do you see New Hanover being in the next 5 to 10 years? Where do you see your strategy changing, if at all, or do you continue to build in where you're strong in this county and in southeastern North Carolina?
I think you're going to see a continued partnership with our physicians, who are the most talented physicians you're going to find in a community. You're going to see us working together to provide a comprehensive range of services to people in southeastern North Carolina. And I think this consumer is going to win, and hopefully I think we can continue to stay strong and operate our businesses correctly, because, as I said, we employ 5,500 people. We feed a lot of families through this organization annually, and that's also an important thing we need to remember.
All right, Jack Barto, appreciate you taking the time this morning, Jack. Thanks very much. Good to see you. Let's go back to you in the studio.